You know, when you think about how healthcare has changed just over the last 5 decades, it is almost mind-boggling. The advancements in technology, the new discoveries, we have really come a long way.
We sure have, and all that progress has required many hospitals to grow and change, but sometimes there comes a point where a healthcare facility has to be reimagined. After all, many were first built decades ago. Well, that's what's happening in Milford. Bayhealth recently broke ground on an innovative health campus project that will include an inpatient hospital with state-of-the-art technology, patient-friendly access, and all private rooms designed around patient needs. So how are they doing it? With lots and lots of practice.
Building a brand new state-of-the-art hospital is not easy. It starts with years of planning, designing, and here in Milford, cardboard.
Out of cardboard, we have created and built to the exact dimension a patient room, an OR, and several other key rooms within the building that we're going to replicate multiple times.
In order to do that, Bayhealth rented an empty warehouse.
And in doing so, we can make sure that we have positioned the equipment in the room the right way, that the door swings don't interfere with access to the room, that line of sights are the best that can be achieved, and we even tested which way the bathroom should be situated in the patient room.
Another part of the project was bringing in medical professionals and other frontline users to offer advice and influence how the real rooms will be designed.
We've done this in the operating rooms, the patient rooms, the emergency department. We've even done it in some of our ambulatory spaces, so our outpatient clinics and our medical oncology and infusion bays.
They even created a mock-up trauma bay elevator to be sure that not an inch of space or a moment in time is wasted when lives hang in the balance.
So we brought the team in. They constructed a life-size replica of what that trauma bay elevator would be, and we brought the physician and the nursing staff and the emergency care team out, and we simulated basically a trauma event. And we were able to prove that that trauma bay elevator would work in its size and scope and how it was being positioned.
What has been learned so far varies from very big to very small, but equally important.
Even to the simple positioning of where a paper towel holder needs to be and what type of paper towel holder we need to use. It seems so mundane, but what we found out was the one that was spec'd and installed in the project in the simulation room was too large, and it obstructed the patient's access to the mirror, to the sink, etc. It's those little things that, from the patient's perspective, mean a lot.
Frontline users who are testing the environment are asked to also think about not just how things are done currently, but to be open-minded to what is not known.
Because a lot of what we're doing is we're building it based on what the industry is going through now and what it's predicting to go through in the future, without knowing what that's going to look like in 5 to 10 to 15, 20 years from now.
In an industry that has grown and continues to grow at such a rapid pace, Bayhealth wants this hospital to be positioned to grow even more in the future without interrupting services.
In the end, our job is to optimize the patient experience and to create quality and delivery of service that is nationally recognized and far-reaching above what we have today.
Designing the labor and delivery rooms takes a lot into consideration, not just the mother and baby and healthcare workers, but family too.
Research has shown over and over again that the more involvement of loved ones, the better the care plan and delivery and healing process can be.
And along the way, community involvement is important too. A website was created for suggestions, questions, and concerns.
We've also been doing town halls and visiting different public forums and hosting those type of interactive experiences with the communities in the southern region of Delaware. Not just here alone in Milford, although it's very important, we've expanded that reach to understand how we get the feedback from this regional perspective.
In the end, Ashton says what is designed and developed in this journey will be something everyone can call their own.
I think it's even more so for the community. And while my wife and my family and I are members of this community, we live here and we get our health care here, there are people that have lived here all their lives. And Milford Memorial has been a part of them. and they are so excited to see what we're doing and to be part of it and to experience that change in their community. And we've received extremely positive feedback about what we're doing, how we're doing it, how we've engaged the community thus far, and our plan to continue to engage them.
Now, the new health campus will replace Milford Memorial Hospital, currently on Clark Avenue. As for what will happen to the Clark Avenue facility, that remains to be seen. Bayhealth will work with the state, city, and people of the Milford community to reimagine what this location can be to improve the lives of people living in Milton. And one thing they did tell us, the legacy of Milford Memorial Hospital is not ending. It's just a new chapter in its life.
Cardboard.
Yeah.
Amazing.
Smart.
Yeah.